morning, everyone, and welcome to Urban Update. I'm Byron Barnett. On the show this morning, income inequality in Massachusetts has become greater than in the nation as a whole. We'll talk about what should be done to step up the war on poverty. Also on the program, Year Up Boston, providing the skills, knowledge, and experience for young adults in our city. But up first, Massachusetts is in the midst of a demographic shift that will leave the state with unprecedented diversity. One of the challenges, however, stems from health care services needing to respond to and serve an increasingly multicultural population. A recent health policy forum tackled this issue as they presented their findings from a new report titled "The Time Is Now: Tackling Racial and Ethnic Disparities in Mental Health and Behavioral Health Services in Massachusetts." To tell us more about the recommendations offered in this report, we have invited Dr. Benjamin Cook, a senior scientist of Cambridge Health Alliance's Center for Multicultural Mental Health Research and at the Harvard Medical School. Welcome to Urban Update. Thanks for coming in. All right. Doctor, first let's just begin by sort of giving our viewers a brief update on the report, who commissioned it and why it was important, in your view, to get it published.
Yeah, the report was commissioned by the Blue Cross Blue Shield of Massachusetts Foundation and the Harvard Pilgrim Healthcare Foundation. And it was really tied together by the Massachusetts Health Policy Forum at Brandeis, and then our researchers, myself, Margarita Alegria, Stephen Loader, at Cambridge Health Alliance.
Take us through some of the glaring disparities found in the report, if you will.
Yeah, what we found was most glaring were the Latino white disparities. Looking at adults, the rates of depression for Latinos were higher than whites, and the rates of those who reported having poor mental health were much higher than whites. That's a surprise. That's much higher in Massachusetts than it is in the rest of the country. So there's that. And then mental health services for Latinos, the rates among those who really needed care, those who were mentally ill, was only about 30% of Latinos who needed care actually received care, compared to more about 50% of whites. So big disparities there. Even for whites, 50% isn't a great number. These people really need care. They experience a lot of psychological distress.
What would you say are some of the elements that contribute to these disparities?
So availability of providers, I think, is a big one. There are some studies that show that in neighborhoods that have a high percentage of African Americans and Latinos and Asians, in those communities there are very few mental health providers. And that's one issue. But in other communities as well, there are long wait lists. And we've heard this in Boston and Massachusetts. In Worcester, we've heard anecdotally that there are few to none mental health specialists, psychiatrists that are Spanish-speaking that are willing to take on new patients. So that's another big one, Latinos. And then for kids, for Latino youth, there are higher suicidality rates. Suicidality is thinking about suicide, planning for suicide. About 1 in 5 Latinos that were in this survey that we analyzed had suicidality, compared to about 15%. So high rates, a real need for mental health services among youth and adults.
How have healthcare services dealt so far with such a drastic and quick change in all these demographics?
Yeah, it's been difficult to catch up, and there's been a lot of work over the last few decades to try and increase the workforce, to try and train more mental health professionals that are culturally competent, that are from racial and ethnic minority communities, that are immigrants themselves, that understand. And it hasn't worked very well. So there's still a real shortage of providers. One thing that we propose in our report is to continue to work on that, to build the workforce who are racial and ethnic minority that speak different languages, but also to spread the workforce a little bit more. There are a lot of community health workers that work in health centers. There are a lot of outreach workers. Massachusetts has a nice network of outreach workers that can be tapped into. We can train them how to detect depression, anxiety. We have some studies at our center that even show that they can be trained to provide therapy. Manualized therapy can be delivered by bachelor's level students, bachelor's level individuals who are outreach workers.
It seems like mental health services seem to be behind the rest of the medical industry.
Yeah, that's a concern, I think, is that it ends up being a lower priority for sure in funding when it comes from funding from the government, funding from hospitals, even within their own hospitals when they're delegating resources. But that's a real problem. It's about 1 in 2 of us at some point in our lifetime will have a mental disorder. About 1 in 5 have had psychiatric disorder in the last year. So these are really high rates. It really impacts our communities, and the burden is very high. And without treatment for racial and ethnic minorities, that burden is disproportionately high.
Now, what is the ultimate goal of this report in your view?
Well, we'd like to raise more awareness about what's going on in Massachusetts in terms of this real need for mental health care. It is about 20 to 30% for mental health care for racial and ethnic minorities. It's about 1 in 10 of people who need substance use treatment who are actually getting substance use treatment. So incredibly low numbers. We want to announce that. We want to make that clear that we really need to do a lot of work in order to reduce disparities in mental health care access and substance use treatment, as well as kind of lift all boats and improve mental health care across the system.
One area in the corporate world is a general lack of diversity at the top in the healthcare service industry. Is that something that needs to be addressed as well, do you think?
There was a 2010 American Hospital Association survey that found that 94% of hospital CEOs are white. It's about 65% of the population is white, so that's a great big difference. But I'm not sure that doing an affirmative action campaign for hospital CEOs is going to work right away to change how we're dealing with disparities. I would think more of incentivizing hospitals and creating incentives that pay providers, that pay hospital agencies for reducing disparities. And then you'll start to see management become more diverse in order to go after those payment incentives.
Okay, Dr. Benjamin Cook, thanks for coming in and thanks for enlightening us on this, a very important topic.
Thanks for inviting me.
Thanks a lot. Okay. When we return, the poverty rate in Massachusetts is the highest it's been since 1960. What needs to be done to combat that? We'll talk about it when we return right here in Urban Update.